Sorry, if I work hard enough, I can in fact unmute myself. Okay, so quick update on where we are with vaccines and what's happening. So as you all know, the Pfizer vaccine was approved in Canada on December the 10th. First doses came on December the 14th. More doses are coming to more hospitals on the 21st. And because we have prioritized staff in long-term care, we will probably be very close to offering as many staff in long-term care as want to get the vaccine in Ontario sometime next week. So that does mean I appreciate how much scrambling that means to get lists of people and to get information and to get people down there to get their doses, and it's all going to be chaos, but it's awesome chaos. Okay, I have to say, I on the doctor's call this morning, there's a bunch of very happy doctors out there who've either had their vaccine or are planning to get it, and it's really amazing that we have managed the recognition in Ontario that long-term care staff are first and front and center is really amazing. Still a lot of issues with the Pfizer agreements about, you know, where it has to be administered and how it has to be administered and what we can do. Those will get better in a couple of weeks. So the FDA meeting is tomorrow, sorry, for the Moderna vaccine, and they just posted their FDA review, which almost certainly means they're going to approve it. And Ontario, Canada is hoping to have the review out and approval on December 17th. That hopefully means that vaccine will get shipped. Maybe not next week, but the week after. And that first shipment is supposed to be 168,000 doses for Canada, which means that we can probably get doses into a quarter or a half of residents in long-term care in the next 2 weeks. So again, this is a message about somebody's going to pick up the phone and call you and say, we want to deliver vaccine on X day, and it will be just wildly, incredibly helpful if you say, I need 24 doses or 67 doses or 92 doses, and here's a list of people, and everybody's set to go when that happens. You may have read in the news that Pfizer's having some manufacturing issues. Again, remember, this is going to be a bumpy ride, okay? Nobody said this was going to be smooth and we were going to be happy and there weren't going to be uncertainties involved in this. So it's just what we're going to have to live with for the next 3 months, getting stuff out. You also notice why we put our eggs into multiple baskets. The Sanofi GSK vaccine's been having some trouble with the dose. In protein vaccines, you have to measure the antigen content, and you have to develop the capacity to measure the antigen content, which is really difficult, okay? And they didn't get it right, and so their dosing of the vaccine in their first phase 2 trial didn't work. So they're going to be behind about 6 months. So it's good that only one vaccine has gone down so far. And it also tells you that protein vaccines are harder than mRNA vaccines. So they're more likely to have delays in them. So it's a really good thing we've got the mRNA vaccines. Next slide. Okay, so here's what we're aiming. You know, we should have about 135,000 doses of vaccine for Ontario. And the top of our list is there. It's about 600,000 people. So I think once we get through long-term care residents and staff, then we're going to be adding First Nations, Inuit, and Métis adults who are also at substantial risk. both those who live in urban areas and those who live in remote communities. I think getting into retirement homes and making sure that we've covered all the private caregivers and getting vaccine to people who are a little bit uncertain, but in 2 or 3 weeks will be okay, that might take a little longer. Hopefully we'll have a dose into everybody by the end of January. Next slide. Okay, so a few questions and issues of things we don't know about vaccines yet that will be coming. The first is that when you test vaccines, generally, you're looking at protection of the individual who's getting the vaccine. That's our standard. And we, the world, society, regulatory people, made a decision that that's what we were going to test first for these vaccines. So we know these vaccines prevent illness in the people who get them. We don't know yet with certainty that they prevent transmission. And you're going to say, well, if you don't have disease, how can you transmit it? And the answer, of course, is you can be infected asymptomatically. So for the first month, while we're watching what's going on, we need to be really holding on to the fact that we may be preventing illness, but we might not be preventing asymptomatic infection and transmission, and we still need to have really good surveillance systems to be preventing outbreaks. Hopefully by the end of the month, we'll have a much better idea of prevention of transmission, and it'll be okay. We also don't know for sure how well this vaccine protects residents of long-term care. There's people over 75 particularly in the Moderna trial, which is nice because that's the vaccine they'll be getting, and their protection looks as good as other people. But people who are over 75 who get into vaccine trials in the community are not frail older people who live in long-term care. And so we also need to be measuring and watching very carefully and making sure that we know how well long-term care residents are protected. Almost certainly much better than nothing, but it might not be perfect. Going to be a lot of discussion about pregnancy and breastfeeding. Again, when we develop vaccines, we do vaccines for non-pregnant adults first. We make really sure they're safe in non-pregnant adults, and then we do the testing in pregnancy. And because of that, we have not tested these vaccines in pregnancy. There are about 20 people in the Pfizer trial who were pregnant and didn't know it when they got their vaccine. And as far as everybody knows, they're fine. But we're still waiting. And because of that, the recommendations vary. So in the United Kingdom and in Canada, the vaccine recommended bodies have said these vaccines should not be used in women who are pregnant or breastfeeding. The United States is taking a softer view and saying that if women who are pregnant or breastfeeding look at their risk and believe that the vaccine is the safest thing for them, that they should be offered vaccine. So it may be that we will decide in Ontario that you can get this vaccine if you're pregnant or breastfeeding, as long as we're really confident that you have thought carefully about it, that you've talked to a knowledgeable healthcare provider about it, that you're making a very carefully informed decision. But in general, I think at the initial vaccine clinics, if women are pregnant or breastfeeding, they're not going to get vaccinated. We also, however, need to be clear that we're not doing this because we think there's a problem. We're doing this because we are always completely precautionary about people who are pregnant. And so people who are thinking that they are hoping to get pregnant sometime in the next 3 months don't need to worry about it as long as they're not pregnant when they get the vaccine. And finally, just like for frail elderly residents with long-term care, we don't know how well this protects immunocompromised people, so we will be offering them vaccine, and because it's likely that it will give them some protection, but we're going to have to wait to find out how well it works. Next slide. Okay, and then 2 things to make you feel good about today, even though to do it you have to look at stupid graphs, okay? So this is for the Pfizer biotech vaccine, And what it does is it looks at protection after the first dose of vaccine, right? We've all been walking around saying you need 2 doses of this vaccine to protect you. That is not true, okay? So if you look at this graph, this is days after the first dose, and you see that at about day 10, the blue line, which is the number of people in the vaccine group who got COVID, flattens right out, and the red line keeps rising. So in the space between after day 14, from day 14 until 7 days after the second dose, people's protection was 82%, okay? So the second dose takes you from 82 to 90, but the first dose gives you a lot of protection after 2 weeks. Okay, be a little careful about telling people this, okay, in case they decide that they're just going to have New Year's parties as a consequence. But it's really hopeful news for all of us involved in worried about long-term care. Next slide. And the graph for Moderna doesn't look as pretty, but the effect size is almost exactly the same. In fact, although it's not significant, people's protection in the first week after they got the Moderna vaccine was 50%. Okay, so, and between a week and 4 weeks when you get the second dose, the protection was again 80%. So this is really good, hopeful news. The faster we can get vaccine to staff and residents and physicians in long-term care, the sooner we'll be over this hump. And that's the end of vaccines for today. Thank you.